Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. For half a century, tobacco control's mission has been clear: end smoking and save lives. It's a battle fought in the courts, in the schools, and in the hearts and minds of Americans. Today, some might say that battle is close to being won, with teen smoking at its lowest rate in 50 years and adult smoking at its lowest in 75. But there's no fanfare, no victory parade, no celebration of what may be one of the public health's greatest achievements. Why is that? Joining us today to unpack this question is someone who knows the fight against tobacco-related disease and death better than almost anyone: Tom Miller, the former Attorney General of the great state of Iowa. A.G. Miller is the longest-serving state attorney general in U.S. history, making tobacco control and consumer protection the keystones of his long career. A.G. Miller, welcome back to the show.
Thanks so much for having me. You do such a great job here. I'm honored to be on your program.
Well, thank you very much. And a quick note to our viewers, this is part 2 of our interview with A.G. Miller, produced in partnership with GFN.TV. In part 1, we take a deep dive into critical issues you don't want to miss. To watch it, visit GFN.TV. Scroll down to the GFN Interviews playlist and check it out. A.G. Miller, I have to say, many of our viewers here in the U.S. know exactly who you are. They see you as a hero for your advocacy of vaping and safer nicotine alternatives. Why are you such a strong supporter of tobacco harm reduction?
Well, when I became Attorney General in Iowa a long time ago, and even during the campaign, I talked about using the law to serve the interest of ordinary people. And, ordinary people have so much at stake in the smoking area. We thought back when we got involved in the lawsuit in the 90s, about 400,000 Americans died each year. And just so much suffering and so much, kids and family left behind. The ordinary people just have so much at stake in terms of tobacco. So for me, that was something that I really wanted to get involved in. And I have to admit that Mike Moore's great leadership on this issue, put it right in front of me. I had to make a decision, and the decision was pretty easy to join that lawsuit. But Mike was the great visionary on all of this and deserves a lot of credit.
So yes, you were one of the architects of the master settlement agreement that everybody talks about, and it brought big tobacco to heel. What was that experience like, and how did it shape your view of tobacco and public health?
Well, it was an incredible experience. It was one of the great experiences of my Attorney General tenure, 40-year tenure. It went on for a long time. It was a great battle, and ended well. So it was tough at the time. Taking on the tobacco industry was really pretty daunting at that period. They were considered invincible, but we got the settlement, and over 25 years we realized over $200 billion. We've got a lot of reforms. We set up the Truth Initiative that's done great work on kids' use of tobacco. So it was an overwhelming victory, and it was an important sort of psychological victory in the sense that tobacco had been invincible up to that point. They'd never paid a dime in settlement or a lawsuit assessment, and they paid probably more than any other industry. So that was a great breakthrough in the whole history of use of tobacco in America.
A.G. Miller, is there a war on vaping going on in the United States?
There is a war, and it's a very unfortunate war. It's within the tobacco control community. Friends are on both sides. I have a lot of friends on the prohibitionist side, and have great allies on the tobacco harm reduction side. But there is this battle that there's a group of us, and it's largely the academics and scientists in tobacco control that believe in tobacco harm reduction, believe that we can save, an incredible number of lives by people switching from combustibles to non-combustibles. And then there are what I call the prohibitionists that, have moved to the point where they want to, for the most part, prohibit nicotine, particularly in e-cigarettes. And so we battle each other and have for quite a while. It's a fight among friends, but it's unfortunate because I think if we united like they did in England around harm reduction, we could save more lives. We saved a lot of lives by those products already. That's our tobacco scorecard, but we could save a lot more.
Why is it, do you think, that public health, those friends in tobacco control you just mentioned, why are they so convinced that safer nicotine products are harmful?
Well, it's a fight between largely the advocates. 90 to 95% of the advocates are on the prohibition side, and the academics and scientists, 90 to 95% of them are on the tobacco harm reduction side. And in a way that makes some sense. But the other factors are that on the prohibitionist side, um, it's partly an ideological thing to prohibit nicotine. Uh, and it's partly the war against tobacco companies and vaping companies. You know, they fought so hard against them for so long. It's natural that they would be suspicious and think what they're doing now is not right, but that's incorrect. And it's sort of a sort of liberal thing, a liberal ideological thing to be against tobacco companies and therefore against vaping. But I must admit, I truly don't quite understand my friends and exactly what they're thinking. But those are some of what they're thinking. You know, Matt Myers is the leader of the group, and Matt's been a longtime friend, and Matt's a brilliant guy. But I wasn't able to convince him, and he wasn't able to convince me. We both tried, but after a period of effort on both sides, we sort of gave up on that.
Wow, that is disturbing to hear, I have to say, A.G. Miller. Let me ask you, since 2018, in the U.S., public perception of vaping has completely flipped. Today, many people believe nicotine vapes are as harmful or even more harmful than smoking. How could that happen?
Well, it's all the reports and so-called, scientists on their side that come out with these studies that indicate harm. But they're just not, studies aren't correct. They're just not viable. But there's so many of them, and the press reports them routinely. It's what I describe as a rat-a-tat-tat, that it just keeps coming and coming quickly. When you're speaking, you always treasure people out in the audience that bob and nod agreement with you. And when I said that at the New Approaches conference, the great advocate, the great woman from New Zealand that's done great work on harm reduction, she was bobbing and nodding. She totally agreed with the rat-a-tat-tat, that it's just a constant. And in some ways, you wonder why it isn't worse, even worse than it is in terms of the numbers, because there are not a lot of studies. There's not a lot of attack on combustibles anymore. It's all on e-cigarettes and now a little bit on pouches, but very unfortunate.
How much of a role did the 2019 so-called vaping-related lung disease, the outbreak, how much of a role did that play in shaping this belief?
That played quite a role, more so than I thought at the time. It got some real visibility, and it had some real harm of the people that were affected. That unfortunately played a very significant role, I think.
Did the CDC's handling of that outbreak reinforce the false belief that vaping itself was to blame?
Yeah, the CDC did not handle that as well as they should have. It became pretty clear fairly early that it was marijuana, not e-cigarettes, that were in the vapes that were causing the damage. And they seemed to be very reluctant to make that point. Mitch Zeller did it, to his credit, at one point. But the CDC and CTP should have really jumped on that and said, no, it's not e-cigarettes, it's the marijuana version.
That did a lot of damage.
It did. And it was going to do some damage, but it could have been cut, the damage could have been cut off by the CDC and CTP.
Do you think that maybe the prohibitionists with inside tobacco control, CDC, CTP, may have exploited the E-Valley outbreak to the benefit of their cause?
Well, the prohibitionists ran with it for all that they could. They thought they had a real evidence against vaping, and that it would really very difficult in terms of the image of vaping, and that turned out to be the case. That the prohibitionists run with something like this, very predictably.
So, I mean, is it okay that public health can be driven by moral causes like this that aren't necessarily backed up by science?
It's not okay, and it's costly. I mean, it's very costly in terms of people switching and save their lives. I mean, that's the whole idea of tobacco harm reduction, is get people to move from combustibles to non-combustibles and save their lives. So, to the extent that is mitigated or reduced, people stay on cigarettes and go to their death. It's really a life and death situation for some people. Hard to say how many, but a substantial number.
A.G. Miller, more than just vapes, tobacco control seems to have widened the war, and now a large portion of the messaging is about the harms of nicotine. Is that backed by science, or is something else driving it?
It's not backed by science. Nicotine, is addictive, enormously addictive. But there's no really good evidence that it's harmful in and of itself. And doctors think that nicotine causes cancer by more than 50%. That's just wrong. That's just in a way shocking. And that's part of the sort of misinformation that's out there. And frankly, we should expect better of the medical community. That the medical community blew it on opioids. They were terribly taken in by these opioid companies and prescribed far too many opioids. And now they're missing it on e-cigarettes and non-combustibles, where their lives could be saving. There are some in the medical community and some of the state medical societies that are really doing good work on this, but there's so many that are not.
A.G. Miller, in part one of our conversation, we discussed your tobacco scorecard, and the data is eye-opening. It shows that in 2024, the U.S. reached its lowest adult smoking rate in 75 years, the lowest youth smoking rate in 50 years, the lowest youth use of any tobacco product in 50 years, and the lowest youth vaping rate in a decade. How extraordinary are these numbers, and what do they tell us about where the country really stands in the fight against smoking?
The numbers are really pretty extraordinary when you stop and think about that. That 9.5% of adults using combustibles, 25 million, down from 36 million 6 years ago. E-cigarettes, up to 21 million from 10 million 6 years ago. And kids having this enormous drop in e-cigarette use, and more significantly, and even bigger drop, of course, in combustible use. This is all good news. This is something we should be celebrating, and it should be something for the dialogue. And also, it shows that there's a real core of non-combustible use that's very valuable. And as you attack them, and policymakers trying to change that, there's a real cost in doing that. That if they're successful, some of those people that will give up non-combustibles will go back to combustibles and their death. So I think it's really important that policymakers understand that this progress has been made. If we try and pull it back, there's enormous loss. If we try and push it ahead, there's enormous gains in saving lives that we can do.
So, I mean, how big of a role did e-cigarettes play in achieving these wins?
Well, it's hard to say. I mean, and for some reason, there's not a lot of good studies on this. And I think the CTP should be funding studies like that to show the relationship, so we know. Our suspicion is they don't want to, because they're afraid that it's going to be bad news for them, bad news for prohibitionists, which almost certainly would be the case. But when you have this dramatic drop in combustibles and dramatic rise in e-cigarettes, there has to be some relationship, and I think there should be a good study on that. Same thing about kids. At one point, the highest e-cigarette rate among kids and the lowest combustible rate. There clearly was a relationship. So I think that CTP should be funding sort of studies like that And funding studies like in Japan, that I'm aware of a study that indicates that there's been a dramatic drop in combustibles, dramatic rise in e-cigarettes, and a significant drop in heart disease. And they're very careful to say that's correlation, not causation. CTP should be all over that and see if there's causation. Likely there would be. These are the kinds of things that they should be doing.
The scorecard also calls out that in 2024, it's estimated that there's 28.8 million American adults now using non-combustible nicotine products. And that's quite a bit over those 25 million adults that are still smoking. How significant is it that so many millions of people in the US are now using non-combustible products?
It's enormously significant because there's got to be a very significant, saving of lives by doing that. We're looking at these numbers, and we call a country a tobacco harm reduction country when there's more people using non-combustibles than smoking cigarettes. And while it's 28.8 to 25 million, there's the question of dual use and tri-use among those with non-combustibles. But we think we can't release the information, but we think there's some evidence, some basis to think that 85% is the right number in terms of reduction for those two types of uses. If you do that, then it comes out to 25.1 million non-combustibles to 25 million combustibles. So we would in 2024, these are 2024 numbers, become a non-combustible nation, tobacco harm reduction nation as a result. And I think that's a real tipping point, and really looks towards the future in a very positive way. But we can do things that can make it more positive than even the trend line is. One of the things is that if CTP really got into the point of actively pursuing and marketing to combustible users to go to e-cigarettes, if they were able to play that role, there would be a significant increase in the right direction and a significant saving of lives. And New Zealand is really the great example of that. New Zealand not only has a low rate now, around 6%, but it got there faster than anybody else. And I asked them, how did they do that? How did they get there faster? And they said it was primarily the role of their government health agencies, telling the public about this and pushing gently and promoting it. So there's this great opportunity again for CTP, I think, to make a huge difference and move us along the line here.
What's your assessment of the FDA's pre-market review process?
It's taken just way too long, and it's too restrictive. They've approved very few PMTAs in a matter of now 5 years or longer. The approvals, I think, are 35 or 36. They just approved the first menthol with Enjoy. It's just taken way too long, and it's way too restrictive. They really have lost sight of what I mentioned, that it's enormous success for adults, and we've done a good job of pushing back on kids' use of e-cigarettes. That should be reflected in their process, and if it were, there'd be a lot more PMTAs granted. And when we have an enforcement problem, to have very few companies that have a legal PMTA is not a good thing.
It seems so disjointed when you have millions of Americans giving up on smoking and choosing safer alternatives like vapes. And then at the same time, the FDA is just simply not authorizing enough products to satisfy demand.
It is. But there's a new group of people running this, and at CTP, Commissioner McCary and Koplo is the head of CTP, and I think they're showing that it could change in a positive way. I think there's enormous opportunity for CTP to move ahead on this, and there's two good signs. One is that they've authorized the dual PMTA, and the other is they've put forward an expedited process for pouches. Both of those, I think, are very positive. And I think especially the pouches indicate that they may do expedited reviews. Jewel indicates that even if it's controversial, they'll go ahead and follow the science and approve it. So those are two really good signs. There's certainly the potential for this group to be better than the Obama administration, better than the first Trump administration, and better than the Biden administration. I'm an optimist, so I'm forever optimistic. Hopefully not too optimistic here.
Well, so, I mean, let me ask you, many believe the FDA has implemented a de facto flavor ban. Is this a fair charge?
I think probably so in the previous administration. Um, they did not approve any flavors. Only one menthol, and that is at the closing days of the Biden administration. Um, they felt enormous pressure from the Congress and from the groups that support prohibition, and just flavors seem to be almost krypton for them. I mean, they were very weary of flavors, which is really obviously a equivalent of a ban. So I think there was sort of a ban of flavors, which I think was very unfortunate.
Let me put this question to you technically, and that do you believe that flavored nicotine vapor products in the United States could play a role to the benefit of public health?
Absolutely, absolutely. That obviously, I think that e-cigarettes have enormous potential in public health, and flavors is what people like the most. It has the most potential among e-cigarettes. That what we don't do is focus on the smoker. And what's a good vape and what's a good non-combustible is not something that sort of appeals intellectually to us. It's something that it appeals as a matter of satisfaction to the smoker. What would be equivalent in satisfaction or closest to the satisfaction of a cigarette about a non-combustible? That really is what we need to be thinking about, and flavors fit into that. And also, more broadly, we don't focus enough on the smoker, particularly in the battle between harm reduction folks and prohibitionists. Um, we really should focus on the smoker, have empathy and concern and understanding of the smoker. The more you understand the smoker, the more you're going to create a good solution. So I just really encourage that. It goes back to my principle of ordinary people. What can we do to help ordinary people, and have an empathy and understand smokers, understand what they really like and want in a product is extremely important.
A.G. Miller, reports suggest over 60% of the U.S. vaping market consists of unauthorized products. Is that a consequence of the FDA's slow and restrictive approval process?
It is. It's very much a consequence of that. Is when there's been this discussion about illegal vapes and how they increase so dramatically. Very early on, I said the most important, most effective thing to deal with the illegal vapes is to authorize flavors for the legal companies. That's a principle of competition. The other great reason that we have these illegal vapes is an enormous mistake that was made by the CTP in 2019, I think it was, and that was the banning of flavors among the legal companies in effect. Um, and it's a great lesson for us that prohibition doesn't work. I think we generally understand prohibition doesn't work. I mean, we have the great example of liquor in previous part of our history, how that didn't work. But that's a good example. What they did is they thought that because kids like flavors, as adults do, if we just ban flavors, we deal with the kids' use. Well, what happened was that the companies that followed the law at that point had about a 85% market share. When the legal companies couldn't use flavors, that gave just an enormous advantage to illegal companies. They violated the law and then sold vapes and that had flavors. So their market share went from about 15% to about 65%. and a 50% increase, and about a 50% decrease, 85 to 35%. So that was all predictable if they banned flavors among legal companies, that the illegal companies would just come in and scoop up the market share, and that's what really created the enforcement problem. And of course, what about kids? I mean, it was all done to deal with kids' use. Well, kids' use of flavors now is 87%. That this was just an enormous failure all the way around of prohibition, and I think we need to learn a good lesson from it.
So the message there then is that prohibition, i.e., the pod flavor ban that happened in 2019, created the market conditions for the explosion of disposables.
That's exactly right. I mean, if you give that kind of advantage to someone, particularly if they're illegal, they're going to run in and take advantage of it, and they did that. That decision created. You're exactly right. That decision created this huge illegal market that everybody's having a difficulty dealing with.
A.G. Miller, what's your take on the recent DOJ and FDA enforcement actions, the $86 million seizure of e-cigarette products, which is the largest in U.S. history?
Well, it's again an example of prohibition. Prohibition, the problems of prohibition. It's very hard to enforce in prohibition, and the CTP is struggling to do this. This was a big action on their part to deal with a problem that ironically they created through prohibition of flavors. But these cigarettes, these e-cigarettes that are subject to the seizures do come from China, and that's something that they're trying to do.
A.G. Miller, in the late 1990s, you fought to hold big tobacco accountable for misleading the public. Today, some argue that public health agencies are doing the same thing. They're misleading people about vaping.
They are, and that's really unfortunate. The CTP had this big campaign, public service announcement type campaign, that had misinformation about e-cigarettes, and which is really unfortunate, and they can do a lot better. And also particularly with misinformation to get kids to stop vaping. I've always argued that telling things that aren't true to our kids to get them to do what we want, never works very well. That's been the history. But the other's the flip side. They should be advocating to advocates. They should be sending the message out loud and clear to advocates that they should switch from combustibles to non-combustibles, like they did in New Zealand. They had this great drop in New Zealand and did it faster than anybody else, in large part because of the public health people in government, taking the lead. That's what they should do. They should have a major campaign soon with CTP on getting people to switch from combustibles to non-combustibles.
Oh man, people would love that.
They would, and think about it this way. There's a little bit of an irony there that Trump could play a big role on this. That a large number of the smokers are Trump people. Who better than him to tell them to switch? It could be amazing.
I'll be holding off on commenting on that one. So I'm generally favorable to Trump, but I've been holding his feet to the fire over the last several weeks because it's been clear that he hasn't done what he promised to do, and that was say vaping.
That's right. I mean, he's got to do more. But as I said, that there's real signs that CTP is going to do more. I mentioned, of course, Juul and the expedited review of pouches as significant signs. So reserve your judgment a little bit, and let's wait and see. If they were to expedite the approval of pouches and approve flavors, that could have an enormous difference. And if sometime soon they did that public health campaign that I mentioned, big difference. We could be like New Zealand, 6%.
Well, so my last question for you is, are you optimistic in a smoke-free future for the U.S.?
I am, because of what's on the scorecard among the success that we've had. The lowest smoking rate among adults in 50 years and in 75 years, and really it's longer than that. We just didn't have the data to go back further. The lowest, cigarette smoking among kids in 50 years. The lowest e-cigarette use among kids in 10 years. Those are all good numbers, and the trend is all in the right direction. So I am optimistic, even though there's so much misinformation, and even though there's this continue to be the great divide in the tobacco control community. I'm basically optimistic. I think it's a difference between the current trend line continuing, which I think it will. It may not, but I think it will, and accelerating that by some of the things I talked about. If we did accelerate that, we could be below 5% in 2030.
And you'll be the grand marshal for the parade.
I'll be the scorecard. I'll be the numbers keeper.